Hello, I'm Dr. Paul Karpecki, Clinical Director at Kentucky Eye Institute. Today I want to talk to you about a very exciting technology that I can't say more enthusiastically how impressed I have been with this. It's a combination of a very well-designed brush, and this is it's the Mybo Clean system. It includes this hydrating lid and lash cleansing gel, as well as this essentially eyelid cleansing brush. And the cleansing brush is not as simple as you'd think about it. It's incredibly well designed. The silicone in this is rigid enough that it allows for effectiveness when you're treating any sort of blepharitis, including Demodex and the collarettes that are base of the lashes. But it's also soft enough that it's comfortable for the patients. It has a design where this aspect that curves out allows it to really fit anatomically perfectly with the eyelid margin, the medial aspect here, temporal aspect here. The bristles within it work very well also because the outer ones allow for that upper eyelid margin, lower eyelid margin, and in between gets both, as well as this pumping mechanism that can occur as the patients are using this when it comes to the meibomian glands. And this 5mm pad kind of area here that allows you to hold it and grip it easily is soft but allows for easy grip. And I do believe even patients with dexterity issues, arthritis, and other factors can do extremely well with this. And if you think about the dental model, which means you go into the office and you have your blepharoexfoliation, your LLLTs, maybe IPLs or thermal pulsation treatments. Then you go home, the analogy would be brushing and flossing. This is as good of a brushing as you can possibly get to for the patient, especially with the Mybo Clean Hydrating Lid and Lash Cleansing Gel. And the gel is very interesting because it goes on as a gel, but then once utilized becomes a foam. It's very comfortable. Don't have any patients complaining about issues related to burning or stinging. Really very little to no scent at all. Fascinating in terms of that technology, and I think because of the Manuka honey in particular, which I've known for a long time to be very effective against Demodex, we're able to get a much less toxic, for sure, non-toxic in this case, and much more comfortable option for patients with blepharitis, including Demodex. So as we do this for our patient here today, it's just a little application. The patient quickly understands how this applies, the medial aspect here, temporal here. Carol, I'm going to pass this over to you. It's all set to go. And we basically go ahead and apply it to your eyelids, do your gentle scrubbing the claw across. As you can see, the patient's doing an incredible job. How he's utilizing, how naturally it flows to there. It feels wonderful, but what's most impressive is the end results. The end results show that even in the clinical trials that were done at Notre Dame, 55% of subjects achieved over 87% decrease in signs, including Demodex. That's pretty remarkable data. It's really difficult to treat, and that was just during the trial that was involved for this combination of the Mybo Clean Hydrating Gel and Cleansing, and of course the Mybo Clean Eyelid Cleansing Brush. So 2 new things, very exciting, definitely worth looking at. Beneficial for your patients, but also for your practice, not just from efficacy, but even from a financial aspect, as these are only offered through individual doctor practices.